Among the 1.9 billion women of reproductive age group 15 to 49 years worldwide in 2019, 1.1 billion have a need for family planning. Of the estimated 10.3 million pregnancies in Nigeria, 24% were unintended. Women with an unmet need for modern contraception accounts for 90% of all unintended pregnancies.
Pharmacy Council of Nigeria is a regulatory agency that is set up by an Act of Parliament, now P17 of 2004, with the sole responsibility of regulating the training and practice of pharmacy and its ramification in this country. The training and practice involve the training of pharmacists in Nigeria and the training of pharmacist technicians. There are various categories of individuals within the PPMV landscape. You have those who are they only know how to read and write, and then you now have those who have the health education. For example, what I mean by that, healthcare professionals who now vary from their primary assignment to PPMV operations, and then you have the pharmacy technicians.
IntegratE, a project in collaboration with the Pharmacists Council of Nigeria (PCN), has since 2017 trained over 400 community pharmacists and nearly 1,000 PPMVs in Lagos and Kaduna states to provide quality family planning services to increase access to contraceptive methods for women of reproductive ages who desire to limit or space the birth of their children. The project brought together multiple stakeholders, including the Pharmacists Council of Nigeria (PCN), the Federal Ministry of Health, the Ministries of Health in both Lagos and Kaduna, and both the Association of Community Pharmacists of Nigeria (ACPN) and the Nigerian Association of Patent and Proprietary Medicine Dealers (NAPMED).
I am pharmacist Samira Abubakar Umar, a graduate of Ahmadu Bello University, and I happen to be the chairman of Association of Community Pharmacists of Nigeria, Kaduna State Branch. We coordinate all the activities of the pharmacists practicing in the state, in the community. I think when the IntegratE came, their coming is to train, to allow us practice, then they will supervise, and then we will document all activities taking place in the community pertaining the planning or the child spacing. It make clients have access to family planning, easy access. Because when you go to the hospital facility, if you see the queue mothers do to get this access, maybe you have 100 women coming to see a facilitator, maybe 1 or 2 of them. By afternoon they are tired, so they can't cope. But now, since they have decentralized, we call them devolvements, they have decentralized the activity to us. It's convenient. Anytime you come, because we open all day, anytime you come, we can access you. Number one, accessibility. We have it because it's not expensive, it's affordable, and you get good care because we'll have time for you to advise you.
The community pharmacists and health specialists are trained on balanced counseling, value clarification, youth-friendly services, and provision of injectable and implant contraceptives. The first category of PPMVs were trained only on refilling of oral contraceptives and family planning counseling.
My name is Samson Sariki.
Dr. Samson. Family planning is very good. Since when I gave birth to her, I've started collecting my family planning till up to now.
Then teaches us about the family planning. I should get back to my first daughter, so I didn't know anything about the family planning. So it's one auntie that told us about the family planning before, and I saw this auntie. And I told her that family planning, let her collect the family planning because of unnecessary pregnancy like that, so that the family planning will help us to maintain this child from 2 years, 3 years before another one will come. As the baby was like let's say 1 year like this. So, and I decided that since something is too hard for now, let us just be using it before something will come up, and she will remove it and get pregnant.
I always advise them to collect family planning because it's very good and it's safe.
With the 3-tier accreditation system that is being advocated, we have a lot of opportunity as a country to harness a large group of service providers who are virtually present at every corner of this country, including the hard-to-reach and rural, very remote areas.
The IntegratE project has done is that they have brought the manufacturers, the marketers, the suppliers closer to the retail pharmacies. They have helped in improving access to the drug products. And like they will say, without product, there is no program. Training is one key thing, capacity development of the pharmacists. Most of the pharmacists that were trained were taken to the health facility, primary health care center to learn more.
Nobody thought that we could actually integrate the private health sector, the PPMVs and then the community pharmacies, and those ones that do not necessarily have the formal hospital setting, to actually add value or increase assets to, the access to family planning services. So IntegratE has assisted us to bring that into limelight, and we've been very supportive of that program because it's a laudable program and it's a program that has assisted the state to achieve a better mileage in terms of contraceptive prevalence rates in the state.
My name is Comfort Akila. I'm 19 years old. I'm a student and I'm a hairdresser. I have not gone into the tertiary institution yet. I'm done with my secondary school. First of all, I put my dream. And after my dream, I ensure I don't do anything that will crumble my dream. I ensure unwanted pregnancy don't stop my dream from coming true. And I make sure I put every effort to see my dream come true. I actually come to her for counseling about pregnancy, unwanted pregnancy. I came to hear how I would go about it. So she told me about using protection, taking pills, using the injections, all the things for unwanted pregnancy. And she told me that if I must have sex, I have to use a protection, even with the injections and everything, to prevent STDs and HIV. When she counseled me, she told me to always get condom. Even if he's not ready for condom, that I should always get it, so that in case if it comes up, it won't be as if he doesn't have it, I don't have it. I want to say to IntegratE to continue what they have started, and I want to thank them all for making our community to understand how important it is to use condom or other protection during sex. And I want to advise the ones outside there that they should also use protection whenever they want to have sex, like condom or the pills, so that they will protect themselves and also have a bright future and happy future at the end.
My name is Elizabeth John from Musasa. I am an IPC agent. We create awareness about the job we are given to do. About child spacing, I do work from community to community. Sometimes I do meet people even walking around along the road. We do create awareness, tell them about how important child spacing is. So sometimes we do meet these traditional rulers too. We visit them, create mobilization among people for the good work of the child spacing, because so many people don't know anything about it. Some they know, but they don't know how to go about it. So we go to house by house to create awareness about it. Like this family planning, I do, if I go to a house, I will like greet them, you know, you have to social rapport, something like that, to like know that you are free with them, because it's not everybody that will come out and tell you everything about his family. I really achieve a lot, like the people around me, some I don't know them, but this project made me to even know more people around, and it helped us.
As at June 2021, over 200,000 women have received family planning services from the trained CPs and PPMVs. Of this number, over 94,000 are new users of family planning services.
We have reproductive health and family planning managers at the LGA levels. They do quarterly supportive supervision. They go around all of our facilities. And since the project started, we also included the PPMVs and the CPs. So each manager in each local government draws a schedule for the 3 months and includes in her schedule the PPMVs within that LGA as well as the CPs.
So we need to develop it and improve it so that the rural people, the hard-to-reach people can have access to quality medicine, quality service, and the provision of counseling to them so that they will take decisions in matters that affect their health.
One of the things that the state should consider is, do they have the number of facilities to be able to scale up services to virtually everybody in the remotest part of the country? So if we are serious about even reducing child mortality, infant mortality, we should all work together to strengthen the operations of the PPMVs, because they are there, they will continue to be there.
Over 600,000 condoms have been dispensed, over 100,000 oral pills have been provided, over 6,000 implant insertions, and over 28,000 injectable contraceptives provided through the trained community pharmacists and PPMVs in the 2 states. Over 340,000 women have been reached with family planning information by the community mobilizers in the 2 states within the same period. The project is looking at the next phase of the intervention to scale up in additional states in 2 phases. Phase 1, adding 3 states where key lessons will be extended, Kano, Nasarawa and Gombe, by December 2021. Phase 2, adding 5 additional states, Borno, Bauchi, Sokoto, Niger and Enugu by December 2022. Inclusive in each scale-up is the layering of provision of PHC services to allow PPMVs provide the minimum package of care for pneumonia, diarrhea, malaria, nutrition and TB according to the National Treatment Guidelines. Over 60% of Nigerians in the lower wealth quintile access primary health services from PPMVs. Many PPMVs have an informal credit register where they record clients who are not able to pay for their care at the point of service. One of the tenets of universal health coverage is the affordability of healthcare. Health insurance is one financing mechanism that helps reduce out-of-pocket expenditure and makes healthcare affordable. To take continued steps towards universal health coverage, it is important that state governments consider including PPMVs to provide the minimum package of healthcare services at the community level under the state insurance scheme. This would help to increase the credibility of the trained PPMVs. This would also give access to over 60% of Nigerians to basic health services that are of good quality without them having to pay at the point of care, moving Nigeria one step closer to achieving universal health coverage.